There are so many ways that a non-medical person can help in COVID. Hey guys, how's everybody? For those of you who don't know who I am, I'm Dr. Anja and welcome to my channel. I started this channel to start teaching, and I started with little videos, and I'm trying to expand it a bit and make it more communicative, I guess. I know we don't want to talk about this again and again, and I've probably been rambling about this a lot, even on my social media, every day about do this in COVID, do that in COVID, but I don't care. As you know that the numbers of India have gone from this in Jan to this right now. Let's just have a little talk about how people think that doctors are the only people who can help in this situation, which is not true. There are so many ways that a non-medical person can help in COVID. In fact, this curve can be flattened by non-medical people, by people who are not doctors. So let's talk. So I know all of you are really nice people and do want to help. I know that you want to help flatten the curve. So here are 5 ways that you can help, even if you aren't a medical professional or you're not in the healthcare profession, but you want to help somebody with COVID, or you want to help this pandemic situation that is happening right now. So point number 1, very crucial, very difficult, and just pay attention. It's really important, and it's quite difficult to do, but it's like the topmost thing that will stop the spread of this pandemic. Are you ready? Stay at home.
Stay at home, guys.
It's not very difficult, right? It's the easiest thing to do, and it's the easiest way to stop the spread. As you know that COVID symptoms can manifest in many ways. You might have heard of a lot of these symptoms. But what we're forgetting is that a lot of people can have asymptomatic COVID disease. So whilst youngsters may feel normal and behave normally and probably have no symptoms, they might be super spreaders or spreading to the vulnerable population, that is the old people, either in your homes or in the places that you're visiting. So staying at home will prevent you from coming in contact with people.
Yeah, who knew? Contact is very necessary to spread COVID-19.
So don't go outside unless you absolutely need to. Number 2, if you're feeling sick and you feel like you might have COVID disease, please call the emergency helpline which is there for COVID virus in your country. For India, I will post it down below. If you think you have the COVID disease, please call the government helpline and have somebody come home and take your test. Do not turn up at the hospital knowing that you're positive, because you know that normally hospital is a place for sick, debilitated old people. And if you're turning up there with your mild COVID disease, it might become severe for somebody else who's present in the OPD or in the crowded place that you enter on that day. So please, if you're a youngster and you have, or if you're an old person without any comorbidities and you're feeling fine, please don't turn up at the hospital. If you're positive, doctors are more than willing to do teleconsultations and tell you and guide you on the phone. If it's absolutely necessary, then you must visit the hospital. Please note that this is only for mild cases and for people without any comorbidities. If you've had a heart surgery in the past or anything like that, please go to the doctor. And if it's an emergency, that's exempt. You have to turn up at the hospital for that. You have to go to the emergency room for that. But till then, please avoid visits to your hospital, because hospitals are already full. It's full of patients. So yeah, as we know, there are no beds, there are no ventilators, and our government is doing a lot to overcome that gap. But this is what you can do to not overburden the treatment that is going on in this pandemic in the hospital. 3, run errands for any high-risk people around your house. We know that COVID affects everybody, but it affects old people especially. It affects them more than any of us. They tend to get more critical than any of us. So if you have old people living next to your house and they do not have any help, or their kids are living elsewhere, you can always run errands like getting grocery or getting their medicines or doing little tasks for them. But while you're doing it, please make sure that you take all the precautions. Don't go running around like touching all COVID surfaces and bringing it back to them and spreading it to them. Don't do that. When you're going out for your own grocery shopping, you can do theirs, and make sure you mask up, you have all the, you come back, you sanitize before you give them the stuff. If possible, sanitize the things that you bought for them. This way you will be helping a great deal of the population, because old people are at risk and we should avoid them getting out at all costs. So this is another thing that you can do. Number 4, if you can donate blood, please go and donate blood in a nearby hospital. Call them before you go, take the adequate precautions and donate your blood. Totally free. Amidst all of this pandemic that's happening, there's shortages of things apart from PPEs and ventilators, shortages of basic things like blood for normal trauma patients and cancer patients. So if you can donate blood, that would be a great thing. And if you've had COVID in the past 2 months, that is within 8 weeks, at least if you've been asymptomatic for 15 days after getting infection, you can donate your plasma to a hospitalized COVID patient and help them a great deal. It'll help them recover faster than they would have ever imagined. So that is another thing that you can do if you have recovered as a COVID patient and right now you are healthy. Guys, both plasma and blood donation is absolutely free and anyone can do it. You can save a life. Think about it, and please think about donating blood or plasma. Last and the 5th point is, if at all for some reason you're not comfortable at home and you are going to visit your doctor, bear in mind that the OPD that you're going to be sitting in has probably entertained a lot of COVID patients and has entertained sicker patients than you. So make sure that you wash your hands nicely, wear a well-fitting mask, that you don't spread any asymptomatic disease to your doctor. Because if doctors start getting infected, then who's gonna take care of all the COVID people, all the COVID patients? So yeah, just keep that in mind. Make sure that you
Sanitize your hands and mask up.
And take all the precautions while you're going to your doctor. And last and foremost, I know I said 5, but this is very crucial. I know it can be frustrating with the lockdowns and everything coming up, but let me put up the numbers again. It has gone from this to this, and we are the only ones who can flatten this curve. We are the people who are going to get infected. So please, let's all together curb this growth of the COVID virus. I know it can be tempting to go out and have functions. I know COVID has put so many of our lives on a halt. So many of our progressions, so many of our opportunities are being hampered because of this virus. But soon enough, if we come together, we can flatten the curve and we can get over this wave. So that's it, guys. That was my 5 ways that a non-medical person can help in this COVID situation. That was it. Thank you so much for having this little chat with me. That was fun. If you found this video helpful, please share it with somebody you think it might help. If you guys like this video and if you want to watch more such videos and more educational content in medicine, please like, share, subscribe to my channel. I'll see you guys in my next video. Bye.